I'm very pleased to be here today to announce or to release this epidemiology report. You know, it wasn't but just a few years ago that data like this would have been unheard of in the District of Columbia. And while it may seem a little kind of geeky to be obsessed with data, evidence-based approaches require data. And what we're seeing now is the fruit of labor that began in 2005 when we contracted with George Washington University School of Public Health to start rebuilding our data and research division within our HIV/AIDS administration. A few years ago, we were relying on data that was a decade old, and now we have the best data of any city in the country. And data is important because it helps us decide, it helps us determine where this epidemic is spreading, which populations are affected, the modes of transmission, and demographically, age groups, gender, etc. And then we're able to take our limited resources and create evidence-based responses. There is a lot of good news in this report, but we continue to labor under the highest rates of HIV in the country. The good news in this report, as the mayor mentioned, is in the last couple of years we've doubled the number of people on our free HIV/AIDS antiretroviral drug program. And it's no coincidence that as we double the number of people on our free HIV antiretroviral drug program, and while we improve testing, that the number of people dying from this disease is decreasing. And the number of people converting from HIV to AIDS is decreasing. In the last couple of years, we've seen about a 30% reduction in HIV deaths. Nationally, there's been about a 15% reduction. So we're on par to be twice as good, frankly, as the rest of the country in reducing AIDS-related deaths. There are a few subsections that I'd like to mention briefly, Mr. Mayor. And I know our director of our Department of Health and the director of hospice, Sharon Hayter, will go into greater detail. But there are a couple of items that are especially rewarding because we've been able, because of this data, to produce evidence-based responses. One is in perinatal transmission. In 2005, the year I became chairman of the Committee on Health, we had 8 perinatal infections. Last year we had 1. And hopefully Dr. Hayter will talk about that. That is a huge improvement. We have doubled down, if you will, and created, I think, one of the most exciting testing programs for STDs in our high schools in the country. We're one of only 2 cities with an aggressive STD training system in our schools. So when you see the numbers going up, you might be alarmed, but it's because we no longer choose to live in darkness. We choose to know. We choose to test our kids. And what we will soon find out, we're in our 3rd or now our 4th fiscal year. In 2007, we had about 12% of our kids tested positive. In 2008, 10%, this is for chlamydia and gonorrhea. We'll soon have our results for 2009, etc. And so what we're hoping to find out is the more we test, the more we treat, these numbers will go down. I'm also pleased with our work with DC Jail. Our decision to go to an automatic testing in DC Jail is bearing all kinds of fruit as well in terms of, while the number of people who are tested has increased over the prior regime, the people who are testing in late-stage HIV is decreasing dramatically. And so the good news today, Mr. Mayor, is that the foundation to be laid a few years ago appears to be paying some dividends. But we have a long way to go. But I do want to take a moment to credit Dr. Vigilance, of course you, Mr. Mayor, for your vigilance on this matter. And I want to take a special moment to thank Dr. Shannon Hayter, who I think singularly has been the most impressive addition of personnel to this fight in the 13 years I've been associated with this government. And so I want to thank her because she's provided 2.5 years of constant leadership that this administration has never had, in my judgment. And these results are a testimonial to her work and Dr. Vigilance's work and the mayor's commitment to this epidemic. Thank you, Mr. Mayor.
Thank you very much.
Yeah.